All right, so pharmacist interventions part 22. All three of these were from yesterday. I had a woman picking up Addyi, A-D-D-Y-I, flibanserin. It's approved for hypoactive sexual desire disorder in premenopausal women. So it's an interesting little medication. It's a serotonin 1A agonist and then a 2A antagonist. Don't really know how it works. There are 7 classes of serotonin receptors and they each have like receptor subtypes. Serotonin 1A has a lot of activity. It has to do with thermoregulation, anxiolysis. It has to do with blood pressure and heart rate. Activity on this receptor has shown a decrease in impulsivity and aggression, and then it's also showed an increase in sociability and then also like sexual drive and arousal. It's also a receptor that deals with like sleep and nausea and stuff like that. Serotonin 1A receptors are on the blood vessels and in the CNS. Some of the other receptors within the different classes are on the GI tract, PNS or peripheral nervous system, and the platelets. So Addyi needs to be taken every single day in order for it to work. The patient that was picking it up had like no idea what this medication was basically. I made a comment about like, oh yeah, make sure you don't drink it with alcohol. And she was like, what do you mean? And I was like, what do you mean? It's the black box warning, like you're not supposed to drink alcohol with it. It can cause severe hypotension or a drop in blood pressure and syncope, which is fainting. This is the main counseling point with it. She said, well, I didn't know what my doctor was sending over. They didn't tell me, they just sent something over. I didn't even know I was picking this up today. So I was like, okay, let's talk about it for a little bit. So it's 100 milligrams, it's given at bedtime. If you're gonna drink alcohol, it can't be more than 3 drinks. If you're gonna take your dose for that night, and then it has to be at least 2 hours after if you drink less than 3 drinks. Or else, again, hypotension and then syncope. It's also contraindicated with 3A4 moderate or severe inhibitors. One example of a moderate inhibitor is fluconazole or diflucan. This is not good if you take that with flibanserin. Out of like 15 patients in one of the trials that took 200 milligrams of diflucan, 20% had a severe drop in blood pressure and or syncope, and one of the 15 patients had a blood pressure of 64/41 and had to be transported to the emergency room. So I thought that was interesting. So again, Addyi needs to be taken daily, and we don't really see effects until about like 4 weeks with taking it. I will say that the FDA originally declined the approval when it was originally submitted due to like basically the risks versus benefits. They needed more literature with that. And then after it was approved, it showed, it's like disputed whether or not it has like a clinically meaningful effect on patients. So about 10% of patients report like meaningful improvements. So it doesn't really help a whole lot of patients, but it is a newer medication. It's kind of expensive, but kind of interesting. So I talked to her about basically the alcohol interaction, when to take it. She thought she was supposed to take it like Viagra, like as needed. And I was like, no.